Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Now, we've got a very special guest for you today. His name is Darren McKinney. So, Darren McKinney is not an author, he's not a healer. Darren McKinney is one of my clients. And Darren McKinney is such a special person that I thought that all of us would really benefit from listening to his wisdom this morning. Welcome, Darren McKinney.
Good morning, Catherine.
So,
How are you?
Darren, I'm doing great. I'm so glad that you're here today. Now, Darren McKinney, I know that you do not have a website and you don't usually do social media, but you're willing for people to contact you. So, will you share with everyone your email address?
Sure. And don't laugh. It's a very simple one I picked a long time ago. It's the color blue, BLUEDUDE 3, the number 3 at AOL.com.
Okay, so we're talking to Blue Dude 3 at AOL.com.
Silly, but yes.
It's okay, and I'm wearing blue today, so I got the memo to
Here we
wear
go.
I got the team color. All right. So Darren McKinney, can you explain for our audience what is your name, how old are you, and where do you live?
I live in Chattanooga, Tennessee. My name's Darren because Dad thought there were too many Jeffreys and outvoted Mom. He was correct. I like Darren's a good name. And McKinney is what I changed my name to about 20 years ago after studying numbers. And so I had a balanced name. I was not born with this name. And it's been a good decision. So, Darren McKinney, and I live in Chattanooga. I was born in this area within 30 minutes of here. And my Southern accent has gotten a little less severe over the years, believe it or not. Uh, but I lived in Central Florida from about 1976 to 86 and moved back up here. And uh, I, what else would you like to know?
How old are you?
I'm 62.
Okay. And I'm Catherine Kerrigan. I'm 65 years old and I live in Atlanta, Georgia. Now, Darren McKinney, will you share for our audience what do you do for a living?
Um, well, due to health concerns and having an extremely low energy level, I have to pick jobs that are possible for me to do. And unfortunately, those end up being low paying jobs. That's a result of you don't want to have a lot of pressure on you when you know you may have issues. You don't want to have a lot of people depending on you if you know your energy levels inconsistent. So I wanted something doable, and I like talking to people, and I like meeting new people and picking them up a bit. So I work at the hospital here in Chattanooga, and I deliver food to the patient's room, try to spend a little time with them. And, it's not, you're not having a good day if you're in the hospital, and I try to make that a little bit more tolerable. So,
And
I've done, sure.
Darren McKinney, what do you do for volunteer work?
Um, I currently, for the last 4 years, we have a nice aquarium here. And up till about 5 years ago, I volunteered on weekends at the aquarium here in Chattanooga and taught you how to pet fish and stingrays and small sharks, not big ones, and butterfly releases, things like that. And sometimes kind of an unofficial tour guide just to help people not miss things in there. And then the last 4 years, I volunteer on Saturday mornings from 9 to 1 at the National Medal of Honor Center right in front of the aquarium downtown. And I figured if you can spend all day talking to veterans, you can go to a hospital and talk to patients fairly easily. Kind of a test there. Military guys are a different breed, and it's my honor to volunteer time there. And so many good things have come out of that.
So, bottom line for a profession, and even during the volunteer time, even though you haven't felt well, you spent every day uplifting other people.
You give back. The odds have been against me for a very long time, and when you do have your successes, you need to not forget where you came from. So this is my way of giving back. I was never going to be a soldier because of a lot of the issues I had, and so that's my way of saying thank you for what you did.
Now, Darren McKinney, you have a diagnosis from your medical doctors. What diagnosis have your medical doctors given you?
Well, the first several I went to, there's nothing wrong with you. Please don't bother us. Uh, I eventually found a neurologist who diagnosed me with complex partial petit mal epilepsy, left temporal lobe. The, the effect of that, it came on during high school, junior high and high school, and we just thought I was lazy or maybe had blood sugar issues and was crashing. Uh, and when I got into after high school, I took a computer electronics course, and we started doing advanced math. And every time I tried to start a new math problem, I'd wake up 20 minutes later, drooling on a desk, wondering what happened to the last 20 minutes. And turns out that's part of your brain that does math and logic, things like that. So I didn't know every time I tried to concentrate on numbers, I was actually activating a seizure. I was fortunate in that the neurologist I found taught other neurologists, and that's the only reason he knew what was wrong with me. It's not something they usually teach every neurologist, I guess. It's that rare. There were only 5 cases that he knew of, and I think I was number 5. And so he called us. The first test came up negative, and I told him, check harder, please. I think there's something going on here. So we did another round of tests, and he called the family in, and he gave me the best news I've ever gotten, which is, I'm sorry to tell you, but you have a rare type of epilepsy. And I jumped up and cheered because someone knew something was wrong with me and believed me. And that was a breakthrough. I said, after this, I think you can't fight something you don't know the name of. You have to know your enemy, and if you don't know what it is. So that was a major breakthrough.
So you have a rare type of epilepsy, and can you share for our audience again? It's complex partial petit mal epilepsy seizure disorder. Did I get that correct?
Correct. It's a mouthful. So most seizures involve the entire brain. It's an all over thing. I only had one seizure my entire life. It started a very long time ago in childhood. It's behind this eye right here.
That's your left eye for our listeners.
Left eye, yes. And I noticed I would get a little bit of a headache right there whenever I would have one of these. We may be sitting there having a conversation, and I would just slump over. Now I'm still usually aware. I would be. Uh, it's not like I passed out completely. I would go paralytic, which means if the building's on fire, I'm hoping somebody has a sense of mind to drag me out because during one of these episodes, I'm not moving. I'm not talking. I may not even be able to open my eyes. So um, that that is what those were like. And there's too many embarrassing stories on things that happen when you lose control of your body at odd times.
Now, can you share for our audience, Darren McKinney, why you wear glasses?
These glasses are actually custom tinted in California. You have to get tested before you do that. So, about 5 years ago or so, at work, the factory job I was at the time, they put in new high intensity fluorescent lights to help us see better. And all of a sudden, I got really bad headaches and nausea, and it was only at work. So I came home. I just had a thought one day. I wonder if these lights have anything to do with it. So I came home and Googled, can fluorescent lighting cause migraines? And the first thing on the list was Irlen Syndrome, IRLEN. And it's not an actual visual problem. It is, and the visual cortex is still intact. The issue is the uh, neural pathways between the eyeball and the visual cortex have uh, basically, it's a handed down generationally. Not everyone in the family may have it, but it is a defect in the neural path. So in my case, yellow lights can't be processed because by the time the signal gets to the visual cortex, it's scrambled. So the brain can't make sense of the scrambled message. So what these glasses do, and they have to be custom tinted for you personally, is they filter out the wavelengths of light that this neural pathway can't process.
So you have a rare form of epilepsy and also Irlen syndrome. Now, can you share for our audience, Darren McKinney, who've not had seizures, what does it actually feel like to have a seizure?
I don't have a frame of reference. If you don't have any seizures activity yourself, it's going to sound odd because you don't have a common experience. So I'm having to explain what it's like to go skydiving if I've never been skydiving or you haven't, there's no frame of reference. So in effect, I can feel it coming on as everything looks the same, but everything changes, like a glass wall comes down, and you know that you are in your world and the real world's out there, and something has changed. And in my case, I would get a few seconds warning. So imagine waking up in the morning wondering if you're going to make it to the end of the day without having to go in an office and explain to a manager, hey, I have to sit for 20, 30 minutes. Sorry, I know you need help at work and that's what you hired me to do, but I've got to sit here for 20 minutes. So the also, if I lose track of where we are, that's kind of goes with the territory with this. It's where you put your little ducks in a row. So if I lose my place in what I'm talking about, that kind of goes along with this. Uh, as far as what it feels like, is it feels like a weakness. All of a sudden, you're going through your day, and then your energy level literally just plummets, and you don't know whether it's an overload or somebody pulled the plug, and no one could ever explain to me what that was. I never, either from a neurological point of view or even a blood sugar, because these crashes, I call them, would happen, and I would go check my blood pressure, right on target, blood sugar right on target. So I never had a satisfactory answer to that.
And with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author, and we're listening to one of my dear clients, Darren McKinney, and we're talking about natural healing for a rare form of epilepsy and Irlen syndrome that he's been dealing with pretty much his whole life. We'll be right back. Darren McKinney, thank you so much for sharing with us your challenges about experiencing a rare form of epilepsy, Irlen syndrome, and seizures. So you're 62 years old. About when do you think the seizures started, and how often would you have them?
In the beginning, we just thought it was, well, since my grandmother had her blood sugar would rapidly change. She would be playing piano at church, and next thing you know, she would keel over and be on the floor. And we just thought that's what I was dealing with. So we didn't really question that. Oh, you got grandmother's blood sugar issues. And when I got into junior high and high schools, when it really got bad, and so it usually happened when I would try to concentrate hard on something. I would just get really sleepy. And yes, I know concentrating makes some people want to take a nap, but this was very different. This was like a systematic shutdown. And so if I did study for school, and I did graduate on time, but I had to go to summer school and night school, and but I did graduate on time. And
And so
okay,
in
I don't want to wander off track. So where were
it's
we?
okay. In recent years, how often were you having the seizures? Were they every week, every day? How often were you having?
Uh, if I'm lucky, I'll go 2 or 3 days. Normally, I have one or two during the day. Um, what brought me to you is the seizures were just part of the problem, but they were getting more and more often, and they were a little longer recovery time. And it was, even though this job, which I love at the hospital, even that was getting to be a challenge. And basically, all you're doing is walking around all day, talking to people, and that was still getting to be a challenge from an energetic point of view. It's just literally not having the energy to walk around. So that's pretty sad situation.
Now, Darren McKinney, what were you looking for when you searched for Catherine Carrigan, medical intuitive healer?
I'd heard of medical intuitive years ago and put it in the back of my mind as something to look into. But you take your simpler, most people, I guess, would take the simpler, more conventional approaches, at least tick that off your list. So, as I believe you said in one of your notes you sent me, most people go through about seven other therapies before they find you. And that's kind of how I found you. Is all the other doors were like, I've looked behind this, I've looked behind this, I've gone that direction, I've gone this direction. And a couple of days before I called you on the 8th or ninth, I called you, sent you a text. And that was because a couple of days earlier, I had a thought like medical intuitive. Maybe it's time to look into that. I've looked at everything else. And I expected, okay, I'll see you in 6 months and we'll put you on a list. And you're like, okay, how's tomorrow morning? And I'm like, are you kidding me? Let's go. And I've not looked back since. We're just making marvelous progress, and I'm very happy with it.
So for our audience, Darren McKinney and I have had 5 sessions. So Darren McKinney, what improvements have you noticed? I remember after I think it was our first or second session, you wrote a long list of what's better.
Ta-da.
Uh, so will you share for our audience what's gotten better since you
Okay,
have
if
been
I'm
working?
looking a little out of camera, I'm reading this. So, energy in general is balance and coordination improved. I'm not as wobbly. Even on good days, I never felt like I was entirely stable. I mean, just felt things weren't quite solid foundation. Then my energy level was low. Now it's very high. Was unstable. Now it's stable. I used to have a lot of crashes. I've not had a single drop, crash episode, whatever you want to call it, since our second session. There's been none since then.
So you've had no seizures since our second session.
None. And it's usually, and it's to the point where, and I need to say this, even on very good days, there were still energy fluctuations up and down, all during the day. It would constantly, it was fluctuate, it was variable. And I can honestly say from the time I get up in the morning till I go to bed, that energy level is absolutely level and straight. It's a straight line. That has never happened in my entire life ever. And I'm just, in general, I went from weak to strong. I went for mood, especially in the morning. My mom, I asked her recently, I said, was there anything difficult about raising me? And she goes, not really. You were a good kid, but I never could wake you up in the morning. And that's followed me my entire life. That has absolutely improved like night and day. Um, my friends are like, you're seeing this, right? Darren's awake and humming and singing in the morning. He's in a good mood. What is wrong with this picture? So it took us all a while to get used to it. We thought, oh, placebo effect. No, it's been 2 weeks. We're good. Um, my moods have gone from sad to happy, pessimistic to optimistic, ungrateful to grateful, chaotic to peaceful, unorganized to organized, unfriendly to friendly, impatient to patient, angry to tolerant, agitated to calm, dread to hopeful, unrested and rested. So if you'd like to keep going, there's more.
Well, let's take a break and share a little bit more for our audience. So I channel all my healing sessions, and did we start with a medical intuitive reading? Is that what we started, or we start with healing work? I
With the first session, there was so much going on with me. We haven't even talked about the other issues. There's GI tract issues, there's kidney issues. We haven't even gotten to that. And turns out energy work was the best start. But uh, we spent the entire first session just sorting through the layers of issues. And I believe that was your term. It's just layers and layers of issues. And I totally agreed with that. That's certainly true.
Yes. Now, I remember two of the big healings that I did with you, and I want to point out for our audience that I haven't used a single natural healing remedy with Darren.
Oh,
No supplements, no flower essences, no homeopathy. This is all working on Zoom through energy healing. And
absolutely.
so one of the healings I like to do in complex medical cases is I like to do a healing with people to be willing to get well. And, Darren would probably say, of course I wanted to get better. I've been everywhere. Of course I wanted to get
Very true.
better. But the healing that I do about being willing to get better is very complicated because there can be what's called pain behaviors where people are unconsciously addicted to pain. There can be patterns that started in this or another lifetime. And I believe some of the things that we cleared for you actually began in a past life. Anyway, we did a healing on being willing to get well, and that always takes an hour. It's quite complicated. And then I did another healing on your energy field. And it's for our audience, it's a law of physics that anytime you have a vertical electrical field, you have a vertical electrical current. And when you're standing up, you're vertical and your whole body's electrical. And then there's a magnetic field perpendicular to that. Now, New Agey people call that your aura. And many people who are highly sensitive people, such as myself, such as Darren, many highly sensitive people, what's actually going on is that there's holes in your energy field. And over the years, in my 31 years experience in natural healing, holes in your energy field can be caused by abuse. So when I'm working with people who have been sexually abused, raped, there's definitely holes in the field. Verbal abuse, emotional abuse, even weird things like going through the X-ray scanner at the airport, that can cause holes in the field. I remember I had a client years ago. She was a Pilates instructor and had gone through a 1 year trial at the National Institute of Health in Washington for back pain. So Vioxx didn't work, acupuncture didn't work, Pilates didn't work. But when I patched the holes in her energy field, that got rid of the back pain. So there's all kinds of unusual situations that literally tear holes in your energy field. And so I knew that Darren was hypersensitive. So I did a healing on his energy field, which took over an hour. And so Darren, will you share for our audience, how did you feel after I fixed the holes in your energy field?
Night and day difference. Just it was actually took me a while psychologically to catch up. It's like it's like you're outside in a storm and you're freezing and shivering and you're wet, and somebody comes along, throws a blanket on you and gives you an umbrella and a raincoat, and you're like, there, that's better, isn't it? And I'm like, yes, it is. You know, I need to say something about my journey with the seizures that's very important, I think, is that I did do a lot of other things to address the seizures. They were a lot worse 20, 30 years ago, a lot worse. Uh, and I probably should expand on that a little bit. When I was first diagnosed, it was not a pretty situation. Um, I was told it was incurable. I was told that eventually it affects your ability to discern the difference from reality versus imagination or fantasy. They blur. And I was actually at that point, and I knew I didn't have a lot of time left if I was going to find out what was going on and avoid those consequences. I had to get to work. And I ended up, it's a long story, but I ended up, my mother was in it, who was very involved in helping me. She was in a store and overheard two women talking, and one of them says, "See you later, Doc." And my mother walked up to the lady and said, "Did she call you a doctor? Are you a doctor?" And she goes, "Well, I'm a chiropractor." And she goes, "Do you know anything about moving bones in the skull?" And my mom to this day says, "I don't know why I asked her that, but I just thought I should ask her, can you move bones in the skull?" And she goes, "It's funny you should say that. I just got certified in that. It's called neurocranial restructuring." And long story short, using the muscle indicator resistance test, she agreed that the seizures were coming from behind the left eye. The focus was there. And then she stood behind me as I was sitting in a chair, put her hands on each side, the heel of her hands on each side of my head, and said, "You're not going to like this, but it'll be okay." She pushed really hard. I heard three cracks in my skull, and I felt something warm on my left temple. I thought she may have squirted like a massage oil or something. I go, "Hey, what's that weird feeling on my temple?" And she says, "What does it feel like?" I said, "Hot." She goes, "Oh, you've never had blood in that artery." Turns out the head injury had shifted the skull bones a long time ago. And as I grew, the skull bones did not align in the correct position. And that was putting pressure on the artery like a kink in a hose. And I did start getting better after that. But after years of living that way, it's a long road back. So it's been a 40-year. This is finding you is the culmination of 40 years of dealing with these problems. It took me that long to get to you,
So
but you picked up where, that the mechanical things that she did. And later on, I went to a chiropractor in Everett, Washington, Dean Howell. He's retired now, but he has taught other people this. And they put balloons in your nose, inflate them, and pop them back in, and it actually spreads the bones like you would split wood, I guess. And there's a bit of pain involved, but they've gotten better at it over the years. There's no swelling afterwards. And it's basically expands on what the first chiropractor did with the skull adjustments, except they can do it from the inside out. And I highly recommend looking into that if you have any type of seizure or even migraine disorders. Um, it could even spinal issues. The curve in my spine improved dramatically because it turns out sometimes the reason your spine curves is not that there's anything wrong with your spine. It's trying to compensate for your skull bones not being aligned. Therefore, they don't sit level on the first vertebra.
And with
So
that,
neurocranial restructuring is what got me on the road to you. If it weren't for neurocranial restructuring, I never would have made it this far.
fantastic. And neurocranial restructuring is a system that many chiropractors practice.
Back then, not so much, but thankfully, it's gotten to be a lot more common. Back at the time, it was fairly new. You had to track them down. I had to fly to Seattle, Washington to find the balloon.
Okay, and with that, let's take another break and listen to a message from one of our commercial sponsors here at UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. We're listening to my client, Darren McKinney, talk about natural healing for a rare form of epilepsy and seizure disorder. We'll be right back. Darren McBratney. Sorry, Darren McKinney. I have a friend named Darren McBratney.
I
He's a really good friend. He's one of my
haven't heard that one before. That's new.
I know that's my one of my best friends, also named Darren. So Darren McKinney, in my healing room, I've got tons of books, reference books, and manuals of healing courses that I've taken in my 31 years of practice. And one of the manuals that I use is to help people clear birth issues. Now, what many people do not know is that the circumstances of your birth, how you were born, what happened to you when you were born, affect you your whole life. And your birth process can affect you physically, that can affect you mentally, emotionally, and spiritually, can set up core beliefs that you have. But when you and I talked, one of the things that came out was that you had a forceps delivery, which means that a doctor used forceps to pull you out of your mother's womb. So one of the 5 healings that I did was to clear issues behind your forceps delivery. And because again, you mentioned how you'd had neurocranial restructuring and these that was and the disturbance in your cranial system was contributing to you having 1 or 2 seizures every day where you would basically pass out and be immobile for about 20 minutes at a time. Will you share for our audience, how did you feel after healing to clear issues about around your forceps delivery?
Well, my mother was 19 at the time. She didn't know it till she got to the hospital. She had a kidney, I believe they call it toxemia, or they would refer to it as kidney poisoning, and she was running a fever. And I got basically hung in the birth canal, and she was unable to push because of all the problems she was having. So we couldn't go backwards or forwards. So as I've heard it, they just took the tongs, grabbed me by the head, and just kind of yanked me out, you know. And back then, I think that was more common. Maybe I'm not sure. Uh, but when we discovered it was seizures, we had to go back through a life history with a doctor to find out what could have caused this. And there were two events. When I was 10 or 12, I got hit in the head with a rock right here. We won't go into that, but kids be kids. And the other was the forceps delivery. And honestly, we didn't know which. We just know it took a took an impact to the head, as far as we know, is what started this.
Yes. And so you and I worked, you're 62, I'm 65. We're working on Zoom, Atlanta to Chattanooga, and then I did energy healing to help clear some of the issues around your forceps delivery. Do you
Yes.
remember how did you feel after that particular healing?
Uh, physically, better, but more so, we'd already, by repairing the energy shield, we'd already addressed my energy level, which at the time was my main concern. But when you're that sick for that long with something no one knows why it's happening, there are psychological and mental things you have to deal with. There are social things you have to deal with. And that's where, in that session, I think we were able to clear away all the emotional baggage and psychological trauma that goes with the physical problem. It's a multi layered issue. And the first thing we did in the first working session is you gave me a shield. I've never had one. That was fun. Many years ago, there's therapy I'd like to briefly mention. It's by Sherry Edwards out of Ohio. I think it's Sharry, Sherry Edwards, and it's in the field of bioacoustics. And so basically, I drove to Nashville a couple hours from here, sat in a soundproof booth, and was asked questions, answered them, and the computer looked at the frequencies in my voice, and those numbers can be translated into a diagnosis. So 30 years ago, they were able to tell me, hey, guess what? You don't have an energy bubble. And I'm like, okay, how common is that? And they go, yeah, that's not good. Thankfully, it doesn't happen very often, but yeah, you don't have one. And the things we were trying to do with sound as a cure because of the seizures, we could not use because they would irritate the seizures. It would result in an overload and a shutdown. So, but it was able to tell me that there was no shield. And I'm trying to stick to your original question. I'm sorry. I think
Okay. Oh, good. So will you share for our audience, because I taught you a technique called cocooning, which is every
every morning,
morning. It's a technique that anyone can do. All right. So that puts you in a beautiful bubble of protection
every morning.
every morning. So Darren McKinney, you and that's one of my best friends, Darren McKinney. Will you explain for our audience how they can cocoon their energy? Because that's probably something everyone needs to learn.
um, well, do you want to do the entire thing? Like you start behind the head, you gather your scattered thoughts and you pull them down to heart level. You do that two or three times. And then you do lower back and you gather the thoughts and feelings in your lower self and you bring those up to your heart with your hands. I forgot to say, with your hands in a prayer position in front of your heart. And I'm being hyper energy sensitive, always have been for better or worse. I can tell a difference just from those two things. But the really fun part is when you spread your arms over your head and you gather a white light, you visualize a white light of protection and you bring that down and close to your body all the way down. And I seal it under my feet. And you're just in a little cocoon, little bubble of energy. And if I'd tried this before our first session, uh, with the hole in my shield, or basically not having a shield, this doing this probably wouldn't have the effect it does now. I'm sure it wouldn't, but since we fixed problem A, we can go to problem B. And so then you do arms spread over your head, you gather a clear blue light of healing, you bring that down and place it on top of the white light. And in my case, I don't know if everyone does this, but you have me doing the gold light of transformation, and that goes on the outside of that. So you're layered white to blue to gold, and you seal that at the bottom. Got it right so far?
Great job. A plus.
I'm a
And
good student, yay.
yeah, you're a good student. So everyone can cocoon your energy every day. And that just basically the white light is the white light of protection. Around that is the blue light of healing. And then you put a golden light of transformation. So Darren McKinney, sorry, again, my best friend's gonna laugh when he listens to this.
He's gonna love this.
He's gonna love this. Darren McKinney, you're now 62 years old. You've been struggling with this rare form of epilepsy seizure disorder pretty much your whole life. What advice would you give to other people who are trying to get well from serious illness?
This is going to sound a bit harsh, but if someone is not supportive of what you're going through, you don't have the luxury of being around that person. It's not personal. It's, I have met so much resistance on my path to you for years. Oh, that's not going to work. Don't try this. So, my advice is persevere. The neurologist that actually discovered the seizure disorder told me it was not treatable.
Hmm.
I said, not good enough. And I said, what's going to happen to me if I don't get, if nothing changes? He goes, oh, eventually you'll lose the ability to tell the difference between reality and fantasy. And he said, don't worry, we'll put you in a facility and we'll take care of you and you won't have to make any decisions. And I'm like, wait, he's preparing me to give up because he honestly believed there was no cure. And I said, I'm sorry, I'm going to fight this. And he goes, well, good luck, but the odds are against you. And I said, do you have any advice? He said, you're smart and you like to read. And he said, look at everything. If you think something will work for you, try it. It probably won't. And you're going to turn over 100 stones. But eventually, if you turn over 100 rocks, there's a chance you may find something. And that's what happened. I found out about NCR, the neurocranial restructuring, and many, many other things we don't have the time to go into, but those are the biggies. And so my advice is, in my case, my intuition came in handy this way, that way. Sometimes you have to trust your gut and not your head because sometimes my head would point me in the wrong direction and your gut says, no, I think you ought to look this direction. So my advice would be don't give up. It's a hard path. It's when I chose to fight this, I went into it knowing the odds were stacked, and believe it or not, that can be good motivation. If if you know your life's going to be relatively easy, it doesn't bring out the fighter in you, and maybe you need to be a fighter. Who's to say that bad things sometimes bad things happen to you, but honestly, and this belief kept me going, was that yes, there's a bad thing happening to me, but in the big picture, it may not be a bad thing. It may be to help you get to where you want to go. So sometimes the only path to the person you want to be is a hard one. If there's a certain type of person you want to be, there's really no easy road to it. You just suck it up and you go the hard road because that's what you're choosing to be. And I believe that when we were talking in a session the other day, I shared something with you I heard years ago and I live by it. It said, calm seas don't make a good sailor. So I took that to heart. So when the bad things happen, You have to realize maybe they're getting you ready or preparing you for something big you're going to have to deal with later. And because you chose to deal with where you're at now, you're going to be better prepared for the bad things that inevitably happen in the future. You're going to be more prepared because you've gone through garbage already. So you know how to deal with it better. How's that?
Thank you for sharing that. And as of this recording, I'm 65 years old. I've worked in natural healing for 31 years. I've studied all over the world. I practiced, I've studied, and I put my heart and soul into my work. So it's truly my great joy. Every day I go to work, somebody gets better. And then when I hear stories like Darren McKinney, it just absolutely inspires me. So, Darren McKinney, any final thoughts for our audience?
If you do this and if you choose to work with Catherine, there's a side effect you need to be aware of. In my case, everyone, because my problems were so severe, I had a large support group at work, at home. You don't make it through something this serious by yourself. You need a support group. And as I got better, there was a bit of hesitation on everyone's part because this wonderful thing we wanted for years, all of a sudden I stopped having these episodes where I passed out. People were still treating me like I was sick because we all knew there was no way you could change that quickly. So you're going to meet a bit of resistance. People are like, are you sure this isn't a placebo effect? And I'm like, well, I'm pretty sure, but let's give it a few days. And then after a week, 10 days, they're like, okay, we're coming around. This may be permanent. So if being sick is your normal, I'll warn you this way is that if all you've ever known is being sick every day of your life and you suddenly get better, it is an adjustment. It's a good one, but it's still a change. And in my case, a very rapid one because we were working at an energetic level and those changes are very rapid. It's a bit, you need a few days and to let things settle. If you're on radio, what I'm doing is holding like a teeter-totter balance line. And I was very far, I had such low energy level. And then all of a sudden I had an extremely high energy level, which was great, but it was extremely high. And then over the next few days, it kind of balanced out. So in my case, there was that to deal with. Is even though even a good change is still a change, so give it time. Don't rush yourself. Healing, even at a rapid level, it still takes time. Bodies need time to recover.
Darren McBratney, you've been listening. Darren McKinney, I'm laughing. One of my best friends. Darren McKinney,
You're gonna cause a complex here.
you've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me at catherinecarrigan.com and unlimitedenergynow.com. Our guest today has been Darren McKinney. You can reach him via email, bluedude, the number 3 at AOL.com. And remember, if you have been sick, don't give up. Help is available.
Absolutely. Hang in there.
Hang
Keep
in
fighting.
there.
Don't listen to the naysayers. You keep focused. You'll get there.
Bye.